you're here today for disclusion time reduction therapy in the hopes that your Meniere's disease is improved, lessened, or just completely eradicated. And can you just tell me a little bit about what your symptoms have been leading up to this appointment?
So periodically, I have tinnitus, which is a fullness, a ringing, lots of pressure, and a swishing sound. And usually following a week of tinnitus, I have vertigo. Usually a day, sometimes it'll last 2 or 3 days. Less severe. If it's more severe, it's a day. I've had Meniere's since 2008, diagnosed in 2011. And it went away for almost a whole year at one point. I don't know why, but it came back. I just have regular occurrences of it since December, maybe 6 episodes.
Okay. So an episode every other month?
Roughly.
Okay. And when you said you have ringing or fullness in the ear, is it both ears? Is it a particular ear? Is it the same ear?
It's only ever been my left ear. I've never had issues with my right.
Okay. And so you went to your GP and you went to an ENT doctor.
Mm-hmm.
And did they do any kind of imaging, like MRI?
I have not had an MRI based on the second ENT I went to. I was pregnant with twins. We couldn't do an MRI at the time. And she said, based on everything I told her, that Meniere's is an undiagnosed diagnosis. Like it's, how did she explain it?
Rule everything out, and this kind of
Right.
whatever's left over is thrown into that.
Right, and I was a perfect candidate for it, except that I'm young. And she said it's not as common in someone young, but young people can still get it.
And you filled out a craniomandibular signs and symptoms for us, and so you did put those symptoms down, but there were also other symptoms that led me to believe that this is really not Meniere's, or if it is, Meniere's could be like the diagnosis of disclusion. It might actually be just a misnomer for an isolated TMJ problem or TMD problem. We've run some scans on you so far, so I kind of know that we're headed down the right path. And there's been some changes in the literature, some recent discoveries where neuromuscular dentists are treating patients and they're noticing that the ringing in the ears are dissipating, vertigo is improving, the fullness that you're talking about in your ears goes away. Okay. So what we're going to do today is we're going to use the computer, a T-scan, a wafer that you bite into, and it's going to guide some of the adjustments that we're going to be making. Mm-hmm. So we're not going to get you numb, and the adjustments aren't going to be that deep. They're just going to be very minute and super accurate, guided by the T-scan. So we're not all willy-nilly in there. Do you have any questions about what we're doing or why we're doing it today?
Well, I understand why. The process is it kind of like you figure out the bite, then you make the adjustments. Figure out the bite, make the adjustments.
Absolutely. So we'll make a couple of adjustments, then we'll set you back up, and we'll use the T-scan to see where we're at in that process.
Okay.
Yeah.
And at what point are you happy with
The results?
Yeah.
When your muscles dissipate, the muscle activity in excursive movements are.
And it'll just show, right?
It'll just show it.
Okay.
Yeah, it'll be obvious.
Okay.
any difference in how it comes together? Does it feel more
yeah.
even?
There's a difference when I slide. There's not really a difference. I can't tell
Okay.
that much of a difference when I bite down.
All right. All right, so I'm gonna give you a week
Okay.
to let things adjust, and then we'll bring you back
Okay.
and reconfirm on the T-scan what we're seeing, and if we need to do a little fine tuning at that
Okay.
time, then we will.
Okay.
All right, excellent. Thank you.
Awesome. Thank you.
So Ashley, you're back here with us today for a follow-up to DTR therapy. And I just want to go over a little bit how you came to seek treatment out for what you were being diagnosed with as Meniere's disease. And I wrote down that your top 3 symptoms were vertigo, teeth clenching / grinding, and ringing in the ears. Tell me a little bit about that.
Well, I was having the tinnitus, like the fullness and the ringing and the pressure and sound distortion in my ear, just my left ear, for several years, off and on. It lasted about a week at a time, sometimes more, and every few months it would get so bad that I would end up getting vertigo. Not every month and not every time I had tinnitus, but at least 4 times a year, sometimes more than that.
So how bad were the early episodes of vertigo that you had?
They were the worst. They were the absolute most severe. The first one I had, I woke up in the morning, I literally turned my head and the entire room was spinning so fast and it felt like I was falling. And I was incapacitated. I could barely get my bearings. I was constantly throwing up from the motion sickness of it.
Okay. But you haven't had anything that severe in a long time.
Right?
Right.
Mm-hmm.
They've been pretty minor up until you had the therapy.
Well, they got more, they increased in how often I got the vertigo and decreased in severity of it. So
Okay.
it would last longer, but it wouldn't be as quickly spinning. I wouldn't be able to drive though, and I wouldn't ever know, when it was coming on. I'd still be very nauseous, still be vomiting, but I could, walk around my house holding the walls, whereas before it was just too much.
The vertigo was so bad you couldn't walk?
The first 2 episodes of vertigo that I had were way too bad. Joe had to assist me to the car to go to the doctor.
Okay.
Mm-hmm.
So you had DTR completed in October, so that's been, how long ago was that? 11 months? No.
Well, no,
10 months.
October was, what is it?
About
8
9 months.
ago?
Yeah, about
9,
months.
okay.
And tell me about these symptoms in the last 9 months since the therapy.
I have not had a single symptom of either tinnitus or vertigo. Nothing.
What about the ringing in the ears?
Nope.
Okay. This wasn't a complaint of yours, but you put down that you did have forehead and temple type headaches. Any headaches since you had the DTR therapy?
I've possibly had 1 or 2. I feel like those are more tension headaches. I have twin 3-year-olds.
Okay. And what about decreased hearing? Was that on the left side?
Yes, it was always just in the left ear. I have not had anything wrong with my ear. Nothing.
Okay. So you were originally diagnosed with Meniere's disease, but I actually told you I think the diagnosis is wrong,
Yep.
and I think you have TMD, and it took a while before we actually did the therapy.
Yes.
What was it that made you decide, I think he's onto something? Was there something that actually, because out of nowhere you're like, hey, I'm good, I want to try this?
I think it was, I talked to Joe about it, and I felt like we had nothing to lose. It was either going to solve my problem or not. And if it was going to solve my problem, doing anything would be worth it. At that point, it was bad enough, and I was afraid to keep living with Meniere's.
Okay. So, are you glad you had it done?
More than anything. Yes.
Okay. Excellent. Any words of wisdom or any insight you could add to, anybody who's watching this that has been diagnosed with Meniere's?
I would say be open-minded, because if I could have solved my problem sooner than later, I wish I would have. I feel like it's an ambiguous disease. It's diagnosed based on undiagnosing you. I don't know. I feel like.
In other words, they rule out everything else, and then if they don't have a diagnosis, you get stuck with Meniere's.
Yes.
Okay.
Yeah. And so, I don't know. I am so happy that I didn't just settle with this is what I have to deal with, and there's really nothing that can help it, because obviously I was completely wrong.
Okay. Well, how long had you been suffering from the Meniere's disease prior to having the DTR therapy?
It started in 2008, and the DTR therapy was 2014, so 6 years.
Okay.
Yep.
Yeah, I'm sorry you had to live with that for 6 years.
Yeah. I'm glad I met you.
All right, well, thank you for allowing me to share your results. My hope with making these videos is that people walking around with the same frustrations and quality of life should know that that's not the end game, that there are options.
Yeah.
So, thank you very much.
Yeah, thank you.